Hello, my name's Sherry Masood. I'm a renal registrar from Southmead Hospital and the UK Renal Registry Clinical Fellow. Today I'm going to talk to you about highlights of the UK Renal Registry annual report, which covers the year of 2020. As you may know, the registry's been working in the UK for the last 25 years. We function primarily as an audit organisation, but also provide a great resource for research and those interested. We collect data on the numbers of patients starting kidney replacement therapy and on those already on dialysis or who have a transplant, describing pathways and measuring specific audit measures. As you might expect, the 2020 annual report was heavily influenced by the COVID pandemic. For example, there are about 7,400 patients starting kidney replacement therapy in 2020. But this was a decrease of 8.6% from 2019. And this was more pronounced in those greater than 65 years old, as you can see on the graph on the right-hand side, depicted by the red line. We believe this is possibly due to attempts to delay dialysis start and also, tragically, deaths in those who contracted COVID-19 with advanced CKD. Draft data from 2021 now indicates recovery in the numbers starting kidney replacement therapy. We also report on outcomes and specifically mortality for people starting kidney replacement therapy. On the left-hand side, you'll see a graph for those who have started kidney replacement therapy and their mortality every 6 months up to a year, or risk of mortality, I should say. As you can see, in the first few months, the risk is higher and then drops down and levels off and then slowly increases with increasing time spent on kidney replacement therapy. This is representative of a 10-year cohort of patients. On the right-hand side, you'll see a funnel plot showing centre variation, and there are these funnel plots throughout the report depicting different data items. In this case, this one shows the 1 year after 90-day adjusted mortality after starting kidney replacement therapy. And it's adjusted for the comorbidities of the patients in the centre, age and sex, and shows a 4-year cohort. So these can be used to find where your centre sits in comparison to others. One other thing that was noted was that the prevalence of patients on kidney replacement therapy started plateauing in 2020. There's about 68,000 patients that were on kidney replacement therapy at the end of 2020. This is a very mild 0.15% increase compared to the year previously, and the first year really that we've seen a levelling off in the number of patients on kidney replacement therapy. Previously, this is increasing by 2 to 2.5% per year, driven mainly by increasing transplantation. We believe this is likely due to fewer patients starting dialysis and receiving preemptive transplants, down to 5.9% versus 8.3% the year prior, and also COVID-related deaths. The proportion starting dialysis with definitive access, such as a fistula or graft, also dropped from 35% to 27%, without an increase in late presentation noted, so likely represents disruption to vascular access pathways and transplant pathways. There was also a reduction in the number of patients on in-centre hemodialysis who were dialysing for 4 hours or more, and this reduced from 71% down to 66%, again likely due to the infection control policies that were brought in due to the COVID pandemic. Transplantation was also disrupted in 2020, with 29% less kidney transplants operations performed that year. 44% less living kidney donor transplants, 33% less DCDs, and 14% less DBDs. However, transplantation continues as the most common treatment modality, with 39,000 kidney transplant patients in the UK at the end of 2020. Median EGFR 1 year post-transplant was 57 mils, and this depends on the organ that was transplanted. So a DCD was about 48 mils, 52 mils for a DBD, and 58 mils was the median EGFR at 1 year for an LKD. The median slope of decline beyond the first year was 0.8 mils. Perhaps a early positive signal from the COVID pandemic was the greater proportion of patients starting kidney replacement therapy on peritoneal dialysis. There's about 3,800 patients who were on peritoneal dialysis at the end of 2020. On the left-hand side, you'll see a funnel plot displaying the proportion of prevalent dialysis patients who were on PD by centre, but it was the proportion starting that we saw the change. And it wasn't an absolute increase in numbers, but an increase in the proportion from 20 to 22%, reversing the trend for PD use decreasing in the UK that we'd seen previously. 2 centres in England and 1 in Wales had a 15% increase in the proportion starting with PD. 3 centres in England had a prevalence of all home therapies of greater than 30%, which includes home haemodialysis. Recommendations from the Getting It Right First Time and the Renal Services Transformation Programme may also help to sustain this increase, which would be welcome, as commissioning and renal services align to allow greater access to home therapies. We also collect data on CKD. So 19 centres send CKD data for 22,000 patients. Now remember, these are secondary care patients and won't be representative of the general population, of which the vast majority are managed in primary care. The median age was 77.6 versus 59.6 in the KRT population. We noted a significant variation in the prevalence per million population, distribution of stages and ages between centres, likely due to different processes for reporting CKD patients. However, we expect increased data granularity with increasing uptake of the UK RDC feed. We collect data also on paediatric and young adults. 106 patients under 16 started KRT in 2020 and 812 were on KRT at the end of 2020. On the right-hand side, you'll see a pie chart showing the different modalities of the prevalent paediatric population. 76.2% have a functioning transplant and 85.5% had a functioning transplant at a time of transfer to adult services. A third of transplants were preemptive unless there was delayed presentation. 26 patients between 60 and 18 started KRT in 2020, and there were 208 on KRT at the end of 2020. The vast majority were managed in paediatric centres, and tubulointerstitial disease was the most common primary renal disease in young adults and paediatric populations. Acute kidney injury is something else that the UK Renal Registry reports on, and we get lab data from all the labs in England. The data is available on our data portal, which is available on the UKKA website. There's an interactive map and interactive tables and graphs where you can adjust the parameters and times to your preference to have a look at the incidence of AKI. What we noted in 2020 was that there were 5% fewer episodes of AKI than the previous year. Although in the first wave, severe COVID-19 was associated with AKI, there was a significant decline in elective activity, and we believe this is the reason that there were fewer AKI episodes. 2021 and 2022 have shown a recovery in the incidence of AKI, and I encourage you to go onto our online data portals where there are interactive tables and graphs with our data available, showing demographics, completeness, centre level reports, funnel plots for centre variation, and the AKI portal. We also provide a patient summary of the annual report, which is designed as an infographic for better visualisation of the data and numbers starting and on kidney replacement therapy. In conclusion, and to talk about future directions, this year, as expected, showed a significant impact of the COVID pandemic with some positive early signs of increasing use of PD, which would be welcome if sustained. The COVID pandemic demanded more timely data collection, with the UKRR producing weekly COVID-19 reports to help shape policy to protect kidney replacement therapy patients. By publication of next year's report, there will have been a significant change in how renal services are commissioned, with a devolution of responsibility to regional integrated care systems. Collecting comparative information in a timely manner will be essential to highlight any variation and inequality. Some measures have already been decided with the Renal Services Transformation Programme, but we remain committed to describing the broadest possible patient pathway. Thank you to all the renal centres again for your support in providing all the data which makes up this report. We look forward to your ongoing support in our move to timely data collection, with more centres now adopting the UK RDC. Thank you very much for listening.